Hi, everyone. Welcome to another episode of Finding Joy in Your Vestibular Migraine Journey. Thanks for tuning in today. I'm Marissa.
And I'm Joy, and we hope you find joy and hope in your journey watching this series. So thanks for watching.
Thank you.
Hi, welcome to another episode of Finding Joy in Your Journey. We have a special guest with us today. Dana is with Smith Balance in Concussion. She is a vestibular rehab therapist who also is a certified concussion specialist, and not to mention also a VITA ambassador. Welcome, Dana.
Thank you so much. I'm excited to be here with you.
Welcome. Yes, and Dana is very special to Joy and I because we actually met through her VITA Invisible Illness support group online. So that was amazing. And Dana, I had found out then, was already a VITA ambassador. And so I started talking to her, and then I got into becoming a VITA ambassador, and then Joy joined as well. And then also our fellow good friend Pat, who is also in the group, has joined as well. So Dana has her whole flock of us ambassadors. So we're very excited to have her on today.
Yes, thank you so much for being here. So Dana, tell us a little bit about yourself. How did you get into physical therapy? Kind of what made you specialize in vestibular rehab, concussion specialists? Yeah, how did all that come about?
Yeah, the path that I'm on is definitely not the most common one that physical therapists take. I think, my journey started, I've been a PT for 25 years now. And it's kind of alarming to me to say those words because it's such a long time. But I just love what I do so much. And when I was deciding kind of what career path to take, it was always a toss up between, do I become a teacher or do I become a physical therapist? And obviously I went down the physical therapy track, and I'm so excited that I did, first of all, because I'm teaching every day. I teach my patients, I teach the community. So without knowing it, as an 18-year-old entering school, I get the best of both worlds with what I do. And from the time I started PT school until this very day, neurology and the brain has always been my fascination and my interest. I started out my career in an acute care hospital setting, where I worked with patients who had strokes and brain injuries, which involves dizziness and involves headaches and balance problems, a lot of the same things that we see in the vestibular world. And eventually my career kind of evolved, and I moved into an outpatient setting like I'm in now. And the vestibular world just became such a good fit for the area that I work in, and it was and still is a huge need in the community. There are just not a lot of therapists that do this, and so I have learned and spent decades working on vestibular coursework and continuing education work, and the same for concussion also, and that's kind of landed me where I am today.
Oh, yeah. So if we take it back, so for those that don't know, can you kind of define what is a vestibular rehab therapist? Like
Sure.
specifically, yes.
Absolutely. So, a vestibular physical therapist is a physical therapist who specializes in the treatment of individuals with inner ear vestibular disorders. So, vertigo problems, imbalance problems, anything related to either peripheral, so the vestibular system in the ear, either those types of disorders, or even how it gets processed in the brain centrally. I specialize in treating individuals with all of those types of disorders.
Thank you. And one more thing we had with that was, how would someone find you as to find a vestibular therapist?
Yeah, so VITA obviously is one really great source. They have a provider network that lists therapists in the area. where you live, hopefully. The problem with that is that there are a lot of therapists that probably don't even know about VITA and registering on that site. So if you can't find a therapist on there, working with your physicians is probably, and word of mouth is the next best way to find a vestibular therapist.
Okay.
What types of patients do you work with generally, and kind of what is the most common type of vestibular that you see?
Yeah, you would think that the most common thing that I would see would be like BPPV, the positional vertigo, because that's the most common cause of vertigo in the adult population. Oddly enough, I see more patients with vestibular hypofunction from one reason or another, be it an infection that causes vestibular neuritis or a labyrinthitis, or I also tend to see a lot of vestibular migraine and Meniere's patients.
Okay. And what specifically, would patients expect if they're going to vestibular rehab? Like, what kinds of things will you work on with them?
So the therapy that we do is very comprehensive. I think there's a misconception that it's just looking at cards and turning your head and that's all that we do. But when someone comes to see me, I'm not going to speak on behalf of the whole vestibular therapy community, but I can speak on how I treat my patients and what I look for. I look at the entire body when somebody comes in. So in an evaluation, I'm looking at how the neck functions. I'm looking at muscle strength. I'm looking at balance, sitting and standing and with and without movement. And then we dive a little bit deeper into how does somebody move? What does their walking look like? Are you able to walk and change directions and turn your head and scan your environment? And then we'll look at more specifically, how is your eye function? Do your eyes move together? Are they not cooperating? Does eye movement alone provoke your symptoms? And then how are those vestibular reflexes testing and working? So there's ways that we can see if your inner ear and your eyes and your balance are all communicating with one another. So we take all of that into account when somebody comes in, and then we turn all of that into treatment.
Okay.
Okay.
And that kind of leads us into the next question. How do you determine which treatment for each person?
Yeah, there's no specific protocol. Every person that comes through the door, if I saw a whole week full of individuals who had Meniere's disease, for example, every single patient would have a different treatment. So there's no one size fits all approach to vestibular rehab. So I really focus my treatments on the patient's goals. If you're a busy mom that needs to be running after small children, we are going to be running after other people in the clinic and working toward those goals. But we really take those deficits and problem areas that we found initially and turn those into your treatment and make it as functional as we can for where you want to be in life.
I love that it's so personalized, that makes such a difference in that person's lifestyle. So, and how long, I know it's different for everyone, but how long is the average time that a patient may spend in vestibular therapy?
That's a loaded question.
I know.
It's so different for everyone that comes in. I would say if we averaged it out, probably 8 to 12 weeks would be an average length of time. But I do have, a handful of people that improve faster than that and they're done quicker. I do have those people who are on my schedule for months and months at a time. And it's just a slower process, and that's perfectly fine. We work at whatever pace and speed is appropriate for that person. And then there's also kind of that handful of people who come in every few months for, we call them little tune-up visits, where, we're doing good, we've met goals, but now they're out in the world and functioning so well that now they're encountering new challenges. And how do we get past those new challenges? Or a flare of symptoms and a return of some of those initial symptoms that brought them in the first place. So those patients are always more than welcome to come back, and we do a little tune-up and get them going again.
Oh, that's great. So some of them will come to you. Like, is it a couple days a week and then they do a lot of the exercises at home? Is that kind of how it is?
Yeah, so I typically will see a person 1 or 2 times a week. We see patients here for an hour at a time. So as you both know, as vestibular patients yourselves, an hour of therapy can be very, very draining and exhausting. So sometimes once a week is enough. Even if I saw people twice a week, 2 hours a week of working on these exercises is not enough to really make a lifelong change. So I think one of the most important things that I do is educate patients about how to carry over with exercises at home, as you mentioned, Marissa, and really take ownership and responsibility for what they're going through. Because a lot of times for a lot of people, these are things that are going to have to continue for a long time.
Yeah.
Yes.
Yeah, definitely. What have you found to be the most rewarding part of your job? And then what's the most challenging part of your job?
I think the most challenging part of my job is making it known that I'm here and there are other therapists out in the world like me that can help people. I think, vestibular patients go through so many challenges trying to find a diagnosis and get bounced around from practitioner to practitioner before they can create the best healthcare team. And so a lot of times, by the time people come to see me, they have already seen 8 or more healthcare practitioners, and they feel very defeated by the time they come to me. So it's very challenging for me to get the word out there that let's try and get people in here before the 10th practitioner. Let's get them in here first or second and start the rehab process early. So I think that's just going to be my career frustration. And until, I have wonderful people like you that I've networked with now, and, we're all spreading the word. So hopefully that changes. I would love to see that change. And then the most rewarding thing is, obviously, I mean, it's the greatest thing to see somebody do something that they didn't think they could do. And from the littlest of things, whether it's bending down to get something off of a low shelf that they've avoided because that motion, they're so sensitive to it, to really complex tasks, getting back to workouts and jumping and running and all of those, kind of higher level things. But it's just the greatest thing in the world to help people get back to their lives.
Yes. And I love that you recognize, the little things, because, that is a big deal to us when we couldn't do even the smallest task, and then being able to do that and working up to other things. So thank you so much.
I always tell my patients, I think it's challenging when you're in the thick of it to see where you've started and where you've come. And so if you don't appreciate those little things along the way, it's a really long, lonely journey. And it's mentally very tough to go through it. And man, those little things add up, and that's what becomes the big thing,
Yes, definitely. Well, Dana, you do so much. And I know through Vita, you had started the Invisible Illness Support Group. You've done that for about a year now, right?
Yeah, like a year and a half now. Mm-hmm.
Yeah. And can you tell us a little bit about that? Like, how did you want to start that? And
yeah, that was really patient inspired. It was working with patients with vestibular disorders day in and day out, and really taking the time to listen to their stories and their frustrations. And a theme that I kept hearing over and over again was that nobody understands. Nobody understands. And I also recognized how important maintaining mental health is as a component of the entirety of a rehabilitation vestibular rehab journey. I don't think it's just one thing over more significant than another. And I am not a psychologist, I am not a social worker, but there were times, there's times where you really feel like you're counseling patients. So what better way to do that, I'm not licensed to do it, but what better way than to connect people and let people know that they are not alone and isolated, even in our small community here. There are other people going through similar struggles. And then the beauty of technology has been being able to reach out to people across the country and connect with people that way too. So, you take a big disorder and a big psychological stressor and connect people with similar backgrounds all over the country. It's the coolest thing to do it. And I'm really proud of that group.
It is, yeah. I just love your group. And I just remember the first time, wanting to attend, and I remember I had a huge attack before your meeting, and I was like, I can't get on this time. And then the next month I got online, and and then being able to attend your meeting for the first time in person was everything, because I hadn't really left the house at that point, and just to connect with others just in the community, because I felt all alone, that there was no one else going through this, at least near me. And so I love your group so much.
I appreciate that. And I will say as a sidebar that I think I sometimes get more out of it. I get just as much out of it as the people that attend. I learn something from the individuals who attend the group just as much as I hope I'm at least sparking a conversation that helps the people that need it the most.
Yes, you do.
Yeah, it's a wonderful group. And thank you again for hosting and just spreading the word, like you said earlier, spreading the word about vestibular disorders. Was there anything else you wanted to add before I ask you our big question of words of hope that you could offer to others while they're going through this journey?
I think that's such a great question. And I really think that the underlying message, and one that I try and share with as many people as I can, is that one, you're not alone. And two, there is help. You are not stuck in this situation. As much as you feel like you are, it takes a lot of work. It takes a lot of advocacy for yourself. And then once you find the right people, vestibular rehab isn't easy. We have to make you feel dizzy and push into your symptoms a little bit and at a prescribed level, without ruining your whole day. And it's hard work, but it's worth it because you can get better and you can get back to doing the things that really are meaningful to you.
Yeah. And I have a quick question as well. I've heard from a lot of people, they've found a physical therapist and one who may not specialize in vestibular.
Yeah.
Any advice to people out there who, maybe just their general doctor said, well, let's go see this physical therapist, but they don't specialize in vestibular. What is your advice? Do they need to keep searching?
Yes, I think that you need to
Okay.
keep searching. I think that you have to find the right fit for what's going on with your problem. If I was having a problem with my heart, I wouldn't go to an orthopedic surgeon. I would find somebody that specialized in what was wrong with me. So I think, all physical therapists get a little bit of training on vestibular rehab and vestibular disorders while we're in school. But then there are those of us who really kind of dedicate our careers to it afterwards and spend hours of continuing ed and practice perfecting what we do and continuing. It's such a dynamic field, and there's new ideas and trends and things coming out every day as we learn more about how the system works. And so if you're not working with someone that's keeping up with that and using the latest research as kind of the foundation for the best treatment for you, I think then you need to work with somebody who's, find someone who can get you there faster.
Yeah, that's definitely good advice. And Dana, so I know you're always busy, you're always doing something new. So can you tell us what is up for you next for the new year? Some new opportunities, what's going on for you in 2023?
Yeah, 2023 is looking exciting. Obviously my favorite week of the year is Balance Week, so we're already planning Balance Week for next year. I have started teaching also at our local community college in their rehabilitation strategies course. And we spend time, it's a PTA program, but I spend time passionately discussing vestibular rehab and concussion rehab, so that hopefully I inspire future clinicians to join the flock, as we should say, and get out there. And I'm really looking to expand the support group and community outreach events in the next year.
Yeah, it's so exciting. I know we're excited to work with you on upcoming projects. So
yes, you guys are so much fun to work with. I appreciate everything that you do.
Yes, we love being part of the Dana flock. So yes, we love it. Where can people find you on your social media links? Where, if they want more information, where can they go to? And we'll link those in the description of our video.
Sure. So the Balance and Concussion Center has a website. So that is at smithptrun.com. And it's under the Head and Balance header on that website. And then on social media, you can find on Facebook, the Smith Balance and Concussion Center. And then on Instagram, I am at Smith Dizzy PT.
Perfect. Perfect. Thank you.
Thank you so much.
Yes, we appreciate you being with us. And any closing words, anything else you wanted to add to the community out there?
I think I just want to add, number one, that keep working and stay the course. Don't give up on yourself and don't give up on being your best advocate. You will find the right people to help you on your journey and get you back to everything that you love doing in life.
That's great.
That is true. Well, we again thank you for being our guest, and we love working with you, and we're excited for 2023. So thank you, Dina.
Thank you so much for coming on and taking the time today, because I know you do so much. So we're so appreciative of you. So thank you.
Thank you. And we hope you all find joy in your journey.
Yep, journey on.
Bye, everyone.
Bye.